I'm so pleased to have edited, along with my colleague Dr. Adriana Youssef, the special section in this issue of the International Journal of Psychology, focused on advances in psychological prevention and treatment interventions to promote children's mental health. We have a collection of 3 wonderful articles that together encapsulate some of the benefits and the challenges of the implementation and the development and testing of research-based practices to promote children's mental health. First, it's probably important to define what we mean by evidence-based practice. One widely accepted definition is the integration of best research evidence with clinical expertise and patient values. That's a more medical definition. The key point here is that what we call evidence-based or effective or research-based or empirically based practices are those that have been rigorously tested, typically using randomized controlled trials, those practices that have a theoretical basis so that we understand a little bit why we're hoping to change our target behavior, what it is we're hoping to change, and how we think it might be changed using the practice. Over 100 prevention and treatment interventions that have been rigorously tested exist for the prevention of mental health problems and their treatment. Unfortunately, few of them are being used in regular practice in community settings around the world. Far more have been developed and are being used in North America and in Europe. But even there is a wide gap between research and practice in children's mental health, a gap that has been estimated to be about 18 years long. The 3 special section articles provide different perspectives on prevention and treatment in children's mental health. The first article, Paths in Croatia, takes an evidence-based practice promoting alternative thinking strategies to promote children's social emotional skills in schools, a program that was developed in the United States of America, and adapts and evaluates that program in Croatia, in Europe. The article is of interest because replications of evidence-based practices to ensure that they are effective not only in the setting that they were originally developed for, but across settings, is really, really crucial. This article is of interest because the authors show that some of the expected outcomes were actually not found, and they speculate why that might be. That is, differences in the context and the culture of the specific country, Croatia, in which the Paths curriculum was tested, might account for some of the differences in the findings. The second article addresses how we can gather knowledge from data sets that don't provide us with gold standard randomized controlled trial data. As you likely know, randomized controlled trials, which are true experiments, are often the only way to establish causality when we are trying to ascertain the effectiveness of an intervention, for example. In this article, the authors take data from a primary care clinic in Chile, Latin America, from over 5,000 patients, family members, in the clinic records to understand how those data can be used to infer causality even when we have only correlational data. And they use a number of methods to establish this. It's a very interesting and important article if you are interested in understanding how to examine data such as correlational, cross-sectional data, and how to use those data to infer some kind of causality. The third article, which uses data from an evidence-based practice implemented widely in Norway, shows us predictors of change in child behavior as a result of therapist and client factors. This article is important because it draws from an intervention, parent management training, the Oregon model, that has been widely validated both in the US and Europe, and specifically in Norway. The Norwegians implemented parent management training in the Oregon model more than 15 years ago and conducted randomized trials to show that the program is effective. In this study, however, the authors take non-randomized controlled trial data and do a really nice job of showing what you can do after randomized controlled trials to learn a little bit more about the factors that might contribute to improvements in children's adjustment. Taken together, the articles do a really nice job of encompassing the range of research questions and clinical applications for children's mental health interventions in Europe, in Latin America, and potentially applicable to countries around the world.